All right, so you wanted to know more about pleurisy, huh? That sharp, stabbing chest pain, right?
Yeah, it's definitely not something to ignore. We're going to get a deep dive into this one. What causes it, how doctors figure out what's going on, and most importantly, how to get some relief.
And that's the key right there, relief. See, most people, they think pleurisy is like a disease, you know? Yeah,
Uh-huh.
it's really not. It's more of a symptom. It's like, how can I explain this? Like a smoke alarm blaring, right? It's telling you there's a problem, but not what's causing the problem.
Okay, yeah, I like that. That makes sense. So break it down for us then. What is pleurisy exactly? For those of us who, well, let's just say haven't spent much time thinking about our lung linings.
Okay, so imagine your lungs are like balloons, right?
Yeah.
And around each lung is this thin, slippery sac. It's called the pleura. And this sac, it's important. It helps your lungs move smoothly in your chest when you breathe. Pleurisy happens when this lining, this pleura, gets inflamed. And then instead of gliding smoothly, these surfaces, they rub against each other. Ouch, yeah, no wonder it hurts so bad. So it's the friction that's the problem, not really the lining itself.
You got it. It's the friction that sends those pain signals to your brain. Now, here's what's interesting. So many things can cause this inflammation. Infections are a big one.
Yeah, that makes sense.
We're talking your typical colds, the flu, even COVID.
Right, right. Those nasty bugs can really mess you up.
Oh, for sure. And then there's bacterial infections, things like pneumonia. I've seen that cause some really severe pleurisy. And in rare cases, even tuberculosis.
Wow, okay. So we're talking everything from a common cold to something as serious as TB, and all of them could lead to the same painful symptom. What else is on the list of possible culprits?
Well, sometimes it's your own body that's causing the trouble.
Oh no, you mean?
Yeah, autoimmune disorders, like your immune system decides to attack your body, and that includes the lining of your lungs.
Autoimmune stuff is so wild to me. Your own body turning against you, that's rough.
It's true, it is. Rheumatoid arthritis and lupus, those can both be culprits.
Man. So we've got infections, we've got autoimmune stuff. Are there even more ways this pleurisy thing can happen?
You better believe it. Sometimes it's an issue directly in the lungs, like a blood clot or even lung cancer, unfortunately, can trigger it. And don't discount physical trauma. Ever cracked a rib?
Oof, don't remind me. Took a spill last winter, and man, let me tell you, that was not fun. So something like a cracked rib can cause all this.
It absolutely can, because remember, inflammation is the key here, and trauma means inflammation. Oh, and here's one that often surprises people.
Yeah.
Sometimes it's a side effect of medication.
Medications. Are you serious? So you're telling me I could take a pill for one thing and it could cause this inflammation in my lungs? How does that even happen?
It's complicated, to be honest.
Yeah.
And it really depends on the medication we're talking about. Sometimes it's like an allergic reaction. Other times it's the medication directly irritating the pleura. It's not super common, but it definitely goes to show you our bodies are strange. And it's so important to look at everything, the whole picture, when you're trying to figure out what's causing something like pleurisy.
Okay, so let's say you're experiencing this chest pain. And I don't mean just a little ache. I'm talking the kind of pain that makes you cringe every time you breathe in. How does doctor even begin to figure out what's going on?
You know, it often starts with something so simple. Listening.
Listening.
Yeah, with a stethoscope.
Yeah.
You can actually hear a certain sound when the pleura, when it's inflamed and those surfaces rub together.
Really?
It's subtle, but with a trained ear, it's a dead giveaway.
Wow. That's wild. So the doctor's like a detective listening for clues.
Exactly.
But I'm guessing a stethoscope isn't always enough to get to the bottom of it, right?
You're right. We usually use imaging to get a clearer picture. X-rays can show if there's fluid building up.
Oh, right, because that's a common complication, isn't it? Fluid buildup.
Very common. Imagine it like this. Water filling up around your lungs, making it harder to breathe.
Yikes. Okay, yeah, that would be bad.
And then there are CT scans. Those are like high-definition maps of your lungs. They give us a very detailed picture of what's going on.
Wow, so we're talking about some really amazing technology to help figure all of this out. But what happens if it eyes that fluid buildup you mentioned? Then what?
Well, if there's a lot of fluid, a doctor might recommend a procedure. It's called a thoracentesis.
See that again?
Thoracentesis. It sounds scarier than it is. Basically, they use a needle to drain the excess fluid, which can really help with the pain and make it easier to breathe.
So it's kind of like letting the air out of a balloon, relieving the pressure and giving those poor lungs a break. Speaking of a break, once the doctors know what's causing the problem, what does treatment look like?
It really depends on the cause. If it's a bacterial infection, antibiotics are usually the best way to go. But if it's a virus, like the flu, we usually just focus on treating the symptoms and letting the virus run its course.
Okay, so there's no one-size-fits-all approach. It's about finding the root of the problem and going from there.
Precisely. But no matter the cause, we've got to address the pain. Over-the-counter pain relievers, like ibuprofen, can be really helpful. And sometimes, if the pain is really bad, a doctor might prescribe something stronger.
That makes sense. You don't want people suffering while their body is trying to heal. So we've talked about treatment, but what if someone just tries to tough it out? What's the worst thing that could happen if you ignore pleurisy?
Ignoring pleurisy can be really dangerous. Remember that fluid we talked about, the buildup? If that's not treated, it can put pressure on the lungs, make it really hard to breathe. In some cases, it can even lead to a collapsed lung.
A collapsed lung. Oh, man. That sounds terrifying.
It's serious. Definitely requires immediate medical attention. And we can't forget about the infections that can be behind all of this. Ignoring a cough that just won't go away, especially if you have chest pain, that can allow the infection to spread. And then you're talking about potentially life-threatening complications like sepsis.
Okay, so this is serious stuff. Definitely not something to ignore. So early detection and treatment seems super important here. Is there anything people can do to avoid this whole mess in the first place?
Absolutely. It sounds simple, but stay up to date on your vaccines. We're talking flu shots, pneumonia vaccines, all of them. These can really lower your chances of getting those infections that can cause pleurisy.
Vaccines.
Yeah.
Not just for kids, right? Adults need them too. What else? What else can we do?
Again, it might seem obvious, but don't ignore infections. That cough that just won't quit. Go to the doctor, especially if you have chest pain. Early treatment can make all the difference.
So listen to your body, and if something feels off, go see a doctor.
Exactly. And if you have an autoimmune disease, you've really got to manage it. Follow your doctor's instructions, take your medicine, and try to make healthy choices to avoid those flare-ups that can lead to pleurisy.
Okay, this has been, wow, super insightful. We've covered a lot. From what causes pleurisy to the importance of getting help and managing those symptoms. It's pretty amazing when you think about it. This one thing, this inflammation of the lining of the lungs, can be caused by so many different things and have such serious consequences.
It really shows how complex our bodies are,
Yeah.
and how everything is connected. What you might think is just a small, isolated problem could actually be a symptom of something much bigger. That's why it's so important to pay attention to those little signs your body is sending and get medical advice when you need it.
You said it. Knowing what to look for and when to seek help can make a world of difference.
Absolutely. Knowledge is power, especially when it comes to our health.
It really is amazing how complex our bodies are. You know, I was looking through one of those articles you sent over, and it said that sometimes pleurisy can be kind of a mystery.
Oh, yeah.
Like, even after running all the tests, the doctors still can't figure out what's causing it. What happens then?
Happens more than you'd think. It's true. Not every case is clear-cut. We call that idiopathic pleurisy. Basically, it means we don't know the cause.
Wow, okay.
Yeah. And it can be frustrating for both the patient and the doctor. But the important thing to remember is that even if we don't know the exact cause, we can still treat the symptoms and help you feel better.
Okay, so even with those mystery cases, there's still hope.
Oh, absolutely.
Yeah.
In those situations, it's even more important to really focus on managing the symptoms. Pain relief, for one, is super important. And if you have that fluid buildup, draining that fluid can make a huge difference. It can really help with the pain and make it easier to breathe.
So even when we don't have all the answers, there are still things doctors can do.
That's good to know.
Yeah.
Thinking about all of this, it makes me think about the emotional side of things, too. Dealing with something like this, something as painful as pleurisy, it's got to be stressful.
Oh, without a doubt. You can't underestimate the mental and emotional toll that any illness can take. It's so important to acknowledge those feelings. And if you're struggling, don't hesitate to reach out for support. Talk to your doctor, a therapist, a friend, a family member, whoever you trust.
Yeah, sometimes just having someone to listen can make a big difference.
It really can. And beyond the emotional support, there are also some practical things you can do to help yourself heal. Rest, for one, is so important. Your body needs energy to fight off infection and inflammation. And don't underestimate those deep breathing exercises.
Deep breathing. But wouldn't that hurt with inflamed lungs?
It can be uncomfortable at first, for sure. But it's important to, kind of re-expand those lungs and prevent other problems down the line. Think of it like physical therapy for your chest. Okay, that makes sense. So take it slow and steady.
Exactly.
Yeah.
And yeah, those deep breaths might be a little rough in the beginning, but imagine how much easier breathing will be when the inflammation goes down. That's what we're aiming for.
That's a good goal. Okay, so we've talked about a lot, the ins and outs of pleurisy, the causes, the treatments. Before we wrap this up, any other words of wisdom you want to leave with our listeners?
Good question. I think one thing people don't always realize is how important it is to talk to your doctor. Don't be afraid to ask questions. You've got to advocate for yourself and be involved in your own healthcare.
That's so true. We're not just along for the ride when it comes to our health, we're in the driver's seat.
Exactly. The more you know, the better decisions you can make for yourself. And if something doesn't feel right, speak up. Trust your gut.
It's true. Knowledge really is power, especially when it comes to our health.
Couldn't agree more. And speaking of knowledge, I think this is a good time to circle back to something you mentioned earlier, those lingering symptoms.
Oh, right, right. You mean even after the pleurisy itself seems to have calmed down?
Exactly. Let's say you've been treated, the pain is gone, you're breathing easier, but something's still not quite right.
Yeah.
Maybe you have this cough that just won't quit, or you notice a little pain in a certain spot when you take a deep breath.
Okay, so even if it's not as intense as before, it's still a red flag.
Exactly. Those lingering symptoms, they're still sending you a message. Maybe not as loud as the blaring alarm of full-blown pleurisy, but still something to pay attention to.
So what should you do if you're having those lingering symptoms, I mean?
Don't ignore them. That's the golden rule. Call your doctor, schedule a follow-up. It's always better to be safe than sorry, you know?
I agree. It's easy to feel like you're overreacting, but not when it comes to your health.
100%. This whole conversation, it makes me think about how pleurisy is more than just a physical thing. It's an opportunity.
An opportunity. How so?
It's a chance to really tune in to your body, to learn how to listen to what it's trying to tell you. We talked about those whispers and alarms, right? Well, our bodies, they're always talking to us, sending out signals. Pleurisy, as painful as it is, it can be like a wake-up call, a reminder to pay attention to those signals and, really advocate for your own well-being.
Wow. I really like that way.